President Trump declared a national public health emergency, and many states issued shelter-in-place orders. And life has changed because of that. There have been unprecedented efforts by federal and state agencies to promote physical distancing, to delay the spread of COVID-19 over a longer period of time. And this has been termed flattening the curve. And there aren't realistic expectations that a treatment or a cure or vaccine validated and brought to market during the period of physical distancing. And already now, I mean, just in this period of time, between, shall we say, February or January to now, the beginning of June, there are already 110,000 Americans dead from COVID-19, and more than 40 million people have applied for unemployment, and more people are uninsured, which will lead to even more deaths. And the harms to the economy and the long-term health effects from sheltering in place are not known. And probably most of you follow some sort of dashboard, and you could see here that we have a total of close to 7 million confirmed cases in the US. And here you could see close to 110,000 deaths. And there's sort of been a flattening of the curve. There's some increase lately, but you see here in the confirmed cases, they've kind of gone up and they've kind of been kind of flat. Like obviously there are daily cases, but they're not, it's not climbing as you saw here in the beginning. And there's sort of, depending on the testing rate, there's some degree of, it's hard to know exactly what the fatality is, which can be discussed. But there is an assumption that there's going to be what we consider excess deaths of despair due to COVID-19. So when I say excess deaths of despair due to COVID-19, so I mean that because of the fact that there is going to be unemployment, and because of the fact that people lose their jobs and they're isolated, we know that there's going to be an increase in mortality, whether it's due to substance use or whether it's due to suicide. We know from previous episodes, such as the Great Recession, that for every 1 point increase in unemployment, there's going to be an increase in deaths of despair compared to the normal amount of people that would be dying. And that sort of depends on what rate of improvement we are going to have from that. Meaning if there's a slow recovery, if there's a fast recovery, that kind of depends on what the deaths of despair will be. And the numbers that we're talking about are very high numbers. I mean, we're not talking about a small number of people. We're talking about numbers that are per year in the tens of thousands of people that will be dying. And I already saw that just in these few months between January and May, there were probably in excess of 20,000 overdoses. This is early data still. And when you look at mental health screenings, there's an app, a website called mentalhealthamericascreening.org. And people here have been screening, and you can compare the data from the same months or several months last year versus these months this year, where people are under the influence of the shelter in place. And you could see that the number of anxiety screenings that were completed and are positive are 370% higher. And the number of depression screenings were 394% higher. So roughly 4%, between 3 and 4 times higher than the baseline, which is a very, very high amount. And we're not talking about just elderly people. These are actually young individuals. And the primary driver that they think is causing this is loneliness and isolation. They're attributing this 60 to 70%, they're attributing to be due to loneliness, isolation. 25% they're attributing this to be due to financial stressors. So COVID-19 actually has redefined a lot of boundaries. Obviously it redefined physical boundaries because we're all keeping some distance from each other, and we're, quote, sheltering in place in some places still, though people are getting out. Sheltering in place is a concept that really hasn't been heard of since the Cuban Missile Crisis, where we really, in medicine, don't tell people that are healthy to stay home. Usually you tell sick people or people that have been in contact to stay home, and that's the term of quarantine. But sheltering in places where you tell healthy people to stay home. And another boundary is this concept where we generally go to visit the sick and we go to visit the elderly. And here we're not doing that. We're doing the opposite. So it's a whole new boundary on that. And you can't attend funerals. So the way, grief is addressed is through customs, and you go and you go to the burial, and then you go and you comfort the family during Shiva, and that contains the most intense part of the grief because it contains it to a certain period of time, and you console the people in that more intense period of time. But now we don't have those boundaries. We're kind of redefining the boundaries, so we don't have those same boundaries. And obviously you have working from home, and the work hours are changed because your home and your fridge and your kids' school are all in the same place. So those boundaries don't really exist anymore. And similarly, you don't have gyms and restaurants and bars, and everybody's wearing a mask, and people are practicing their jobs in a completely different way. And there's a lot of uncertainty about the economy. Some people have a lot of food insecurity. Living in Palm Beach, it's interesting what you can't find. You can't find anything that can be stored forever. I have no doubt people's garages are filled with pasta and canned foods, and as if they must have like a 4-year, because those are the things you can't find. And obviously everybody knows about the toilet paper insecurity, and the bidet business is flourishing. So why am I giving you this depressing introduction? Because I want to talk about stress. And actually, in stressful times, it's appropriate and it's useful to feel stress. Stress is something that motivates us to accomplish things. And there's a difference between stress and distress. So stress is not overwhelming. Stress is something that we use to help us get things accomplished, meet our deadlines. But distress is overwhelming and it's distracting. Kind of the idea you think about is the sympathetic nervous system, which is the flight or fight part of the nervous system, not the relax and digest part of the nervous system. The nervous system that tells you, hey, there's a tiger chasing after you, you need to run away. And when that happens, all of your focus is on that, and you can't focus on anything else. So what we need to do is we need to distinguish between our responses being normal to the situation, or are they abnormal to the situation? So is our feeling of stress normal to the circumstances, or is it abnormal to the circumstances? So a mental illness evaluation during the pandemic, it obviously can involve a new condition or new symptoms. It could also involve an exacerbation of an underlying condition, meaning somebody who normally has depression, anxiety, who normally has insomnia, and it could be an exacerbation of that. Somebody who normally has some marital issues, and now the marital issues or child, parent authority issues, and now they're obviously exacerbated due to the fact that they're all locked with each other, all the time at home. There could be obviously normal anxieties that we mentioned that people want to bring up. And there could be some exacerbations of certain behaviors due to the fact that people can't go out. And we know that social contact is incredibly useful in substance use, in preventing substance use and in treating substance use. We know this even in animals from the 70s already. So when people are alone, they drink pathologically, meaning they drink in a way that is unhealthy. Animals drink in a way that's unhealthy. People generally, you don't see them at a kiddush getting hammered. But when people are alone, they drink a lot more, and they drink to an unhealthy degree. And surveys or these screeners some of them that I was mentioning to you are showing that people are actually at home during work, doing work at home, but drinking while they're home. And these are some problems that are coming up now that didn't exist before. People don't wait till 5 o'clock to start drinking. They're drinking from the morning. There's also the concept of survivor guilt. During any pandemic, the people that don't die, have feelings of guilt for their surviving while other people are not. There's PTSD, which which is a psychiatric condition that's very common, but it happens when people's lives are in imminent danger, or someone they are close to dies suddenly, or someone they're close to almost dies suddenly. And now this has happened to many people. So this is something that's coming up a lot during COVID-19. And as you know, people are getting these diagnoses, and from these diagnoses, it's causing them to do some things that are, so that there's some doctors that have killed themselves, some EMTs that have killed themselves that have gotten a lot of publicity. And there are some distortions regarding the availability or risk of treatment. So people don't realize that they can get treatment still, whether they can get treatment in person or they can get treatment during telehealth. And there's been a 60% decrease in healthcare utilization across the board. So actually, what's interesting is that it's suddenly like, no one's getting heart attacks, no one's getting, any illnesses other than coronavirus, no one's going in to seek medical care. But that's actually what's happened. There's been this kind of concept of people just not going to seek help. And there is a tremendous increase in excess deaths in certain parts. When I say excess deaths, I mean looking, for example, at the amount of people that have died in, say, New York during this period of time versus the same period of time in 2019. And it's not explained by coronavirus, but it might be explained, for example, by people not seeking help. It might be explained as one component of it. I mean, when I say a tremendous number, I mean something like 30,000 in a few months. I mean, during this period of time, maybe 8,000 people should have died in New York, and you had 10 times that amount. And some of it could have been explained by coronavirus, but a lot of it is not clear why it occurred, and we'll only know about that in like a year from now. So some of you saw before Israel announced the sheltering in place orders, there was some advice that was put out on the internet by Natan Sharansky. But in case you didn't, and you don't know who Natan Sharansky is, he was a very well-known refusnik who was imprisoned by the Soviets from 1977 to 1986, so about 9 years, and half of that time he was in isolation. Then he later on became an Israeli politician. He wrote a couple of very popular books. And he gave some tips to survive isolation. So he said, remember why you're in isolation, make goals that are completely within your control to finish, never give up your sense of humor. The Israeli Department of Health announced that people, should, if they are not married, they should go into isolation, on their own. But if they are married, they, should still stay with their wives. Enjoy your life a little. So what hobbies do you have that you can still do? And remember that we're all in this together. These were some tips that he gave. And I think we'll go through these a little bit more detail in this talk. And I think a lot of the rest of this talk will be on self-care during COVID-19. And I think to take care of yourself mentally and physically during COVID-19, education is very important. What is COVID-19? And before you get into what is COVID-19, what is a virus? What are other viruses that cause illness? How does a virus cause illness? What about COVID-19? How are other viruses treated? How are viruses different from bacteria and cancer? What's an immune response? Why do we have vaccines for some and not other infections? And what are pathways for developing antivirals? And I think these are important things that people should think about and research, and use websites like the CDC or the World Health Organization or their state's Department of Health website, or some medical university like the Mayo Clinic or Johns Hopkins or the Cleveland Clinic, but not use news outlets or social media. If you use news outlets and social media, you have to really use them in moderation, because the purpose of news outlets and social media is to engage you and keep you engaged and keep you there and keep you there. And it's by default sensationalist. And, you don't want to have that as your source for getting an education. You want just facts to be your source for getting an education. Now, mental health requires freedom of choice, okay? And Gordon Livingston sort of described this in or the opposite of this, is that the salient characteristic in every emotional disorder is that a person who has it is constrained in some way. The way we define, a mental disorder, like whether it's depression, anxiety, is that it prevents the person from functioning in one of the arenas, okay? And what you want to do is you want to keep perspective all the time about you want to keep perspective all the time and see if you're not capable of keeping perspective, then it's more likely to lead to a condition or a psychiatric condition that you're going to need treatment for in a psychiatric office, so to speak. So what do we know? So we know that COVID-19 didn't really change between January, February, March, April, May, and June. We probably did flatten the curve, and we did flatten the economy, and for many people, we flattened our psyches. It's certainly more deadly than a seasonal flu, but less than most other viruses you have heard about on the news, like Ebola or rabies. And the fatality goes up significantly above age 60, 70, 80, incrementally, and with certain comorbidities. But the fatality is really minuscule under the age of 50, and the fatality is pretty high over the age of 70. It's very contagious, but it's also not as contagious as measles, mumps, rubella, or pandemic influenza, like the influenza from like 1918. And it's only spread through respiratory droplets and aerosols, but it's not spread through incidental contact. It's not spread through, for example, eating it, or it's not spread through shaking hands and so on. You have to inhale it. It has to go in through the lungs. So going forward, how are you going to think about this? Are you going to still have social interactions? Are you going to wear a mask outdoors? If you bump into someone in the street, in the grocery store, are you going to be very agitated? Are you going to still see your grandparents? Are you going to wash the groceries? Are you going to wash the doorknobs? So it is very likely, it's very possible that COVID-19 will become endemic. Endemic is kind of like the term we use for malaria. So you probably know that when you go, because we don't have malaria here, but there are other infections like HPV, human papillomavirus, is endemic. That's like the infection that causes warts, and it also causes cervical cancer. But people in India and in Africa, in many countries, malaria is just something that they live with. So we have to decide what level of risk we're willing to take. And probably age plus comorbidities are the biggest moderators or risk factors, but you can't also, ignore the fact that quality of life, isolation, and depression are very significant. And you can't just lock old people up in nursing homes with caregivers that will never see anyone and so on. So these are things you have to take in mind going forward. So many of you are working from home, and obviously that's a very challenging scenario for you, and maybe even for the kids too. So we have some suggestions. I can't say that you should do all these suggestions, but and you can email options. And it's very important. It's very important that you have goals. And when I say goals, there's a term that we use, which are called SMART goals.
I'm gonna have the pear and kale salad and the penne.
Sarah, can you mute your phone, your screen? Mute yourself. Sorry. SMART goals. And SMART goals are specific, and one way to do it is to write it down. You should pick a goal that's measurable, be very specific. It should be something that's attainable. You don't want to set a goal that depends on someone else doing something first. And they should be consistent with your long-term plans. And they should be time-bound. You should set a specific deadline. So whether these goals are related to you have many goals that are short-term and long-term goals, but obviously, for example, I want to do this exercise. Okay, that's good, but you want to be more specific. You want to say, I want to walk 4,000 steps a day for the next 7 days. Or if you want to say, I want to read this book. Okay, that's one thing. We'll say, okay, I want to read 50 pages from this book every day. Okay, or for example, instead of saying I want to write a paper, you want to say something more specific. You want to say, okay, I'm going to write today, I'm going to write the outline for the paper. Tomorrow I'm going to write, 2 pages from the paper, etc. So you kind of set very specific goals, and you want the goals to be consistent with your long-term plan. So if, for example, your plans are to be a pilot, but you're right now working on something that has nothing to do with being a pilot, maybe that's not the best project for you to be doing. You should be reevaluating whether your goals are fitting in with your long-term plans. Now, always work with some sort of structure, okay? And the structure, by structuring, I mean, literally you put down every single day, I do this at this time, and I do this at this time. I wake up, and from 6 to 7:30, I do exercise. At 7:30, I pray, and then I do this, and I eat, and then I go to work from this time to this time. And you literally put down, I do laundry this day, I do that. Every single thing you can put down on the calendar, and that's how you maintain a structure, and you're able to be more accomplished. Because as we mentioned, the coronavirus has taken away normal structure that you have. Your normal structure involved you going to work, and on your commute to work, maybe you thought about what you were going to do at work, and on your commute back home, maybe you thought about what you were going to cook for dinner. Well, now you lost all those natural boundaries that existed. So now you have to be more focused on recreating that to be successful. And that's what you have to do. You have to recreate these boundaries. And some of you remember Reader's Digest, laughter is the best medicine. And sometimes it's very good to get some of your laughing tips from the World Health Organizations. So we must all be ready for the coronavirus. You need to dab when you cough, dab when you sneeze, dab to beat the coronavirus. I don't know about what dab means where you are, but in West Palm Beach, it's something slightly different, and I can assure you it does not help the coronavirus. And I also thought this was an interesting one as well. And I think this, for example, is a wonderful thing that came up because of coronavirus, and it's likely going to stick out no matter what happens. And that is that people need to proactively schedule and seek out socializing and support, even from a distance. So to stay mentally healthy, you need to schedule these, family and friend Zoom calls. You need to schedule them and actively get support and seek support and give support even from a distance. And I'm sure this is going to stay this way, even if, for example, there was a miracle and coronavirus just disappeared. I think these will continue because people have found these to be tremendously helpful. And there are so many free platforms that allow you to do this. I mean, we're all on Zoom now, but this is Microsoft Teams, and you also have Google Meet, and you have so many Skype. You have so many abilities to do this. Another concept that that you might be familiar with from behavioral therapy, or from Gordon Livingston uses the term feelings follow behavior, but DBT has the concept of opposite to emotion action. So if you have a feeling that you're experiencing, you can let that feeling overtake you, but also you should know that if you act in a certain way, your feelings will follow the behavior, or will follow the action. So if you're feeling sadness, you can watch a funny movie. And even though you're not feeling funny or happy, it'll make you feel differently. The same thing, if you're fatigued or you're tired, you can, do something that's listen to something that's fast or loud, or you can do some push-ups, or you can go for a quick run, and it will give you energy. Most of you know this. If you do exercise in the morning when you're tired, it energizes you. If you're isolating, do the opposite. Reach out to a family member or a friend. Do the opposite, and it will actually change your emotions, okay? Everybody knows about exposure therapy. If you fear something and you do a little of what you fear, if you're afraid of heights and you start standing on a chair and then you start standing on a table, you will get over it. If you feel anger, you know, you should do the opposite. Don't lash out at the person you feel anger out to. You should do the opposite. Move closer and try to think of something positive about that person, etc. So it's very important to form healthy habits in the new setting that you're in. So, you know, gyms in recent years have become incredibly cheap, and unfortunately, you know, with these memberships of, you know, times $10 a month or less, but actually you could still get exercise equipment relatively cheap. You don't have to get a $2,000 Peloton. These are bikes that you can get from QVC. You could type in Fit Nation on QVC. You can get them from QVC. These are like maybe $240, literally $240. This one is like a recumbent, and I mean these bikes are like $250 or $240, and you don't even need an exercise bike at home. You could do a home workout plan with all sorts of pulled off of Pinterest, but obviously you can do jumping jacks and sit-ups and push-ups and lunges and planks and lots of great exercises that you could do in your home without any exercise equipment whatsoever. Or you can walk along the intercoastal or your neighborhood parks and have a great day. So we mentioned earlier that there's stress that is, there's stress and then there's distress. And when you feel stressed, that's sometimes motivating. When you feel distress, it overtakes you, and it's all you could think about is whatever's distressing you, and you have that flight or flight reaction. And there are several calming techniques, and I want to emphasize that there's no one calming technique or grounding technique that's better than any other one. They're all just whatever technique works best for you. And how do you get a technique to work for you? Well, the way you get a technique to work for you is sort of like, how do you learn to hit a foul shot during a basketball game? Well, you have to practice it in your backyard or at the local, you have to practice it at the local court when there's no stress and there's no pressure and when you're calm. So a common one is deep breathing or progressive muscle relaxation. But here is 4-7-8 breathing is one of the earliest ones people learn. So you sit in a comfortable position, you try to relax your shoulders, you take in a deep breath through your nose for 4 seconds, you hold it for 7 seconds, then you breathe it out through your mouth, kind of like you purse your lips, and you breathe it out through your mouth for 8 seconds. And what you do is, all you do is you focus on your breathing. And if you do this, you practice this like 3 times a day for basically a few minutes, 2 to 3 minutes, when you're relaxed. And then you practice it a few times a day in a busy situation, like a noisy situation, when your kids are making noise or when other people are making phone calls. And you keep doing this every day, and then you are able to use it under circumstances when you're feeling overwhelmed, because you'll have practiced it, and then you'll be able to make that foul shot, like when the game is like, the clock's running out on the game and that shot really matters. And there are some other methods here which I listed. For example, this one's focusing more on the cognitive component of the stress, meaning not the physical component, but the cognitive component. So here you breathe in, you name 5 you name 4 things that you can feel, you name 3 things you can hear, and you name 2 things you can smell, and you give yourself some sort of a compliment, or you recite 1 positive affirmation. And you see that calms you down. Again, you keep practicing this, and these things are supposed to kind of keep you in the moment. Just like the first one, you're focusing on your breathing. This one here, you're focusing on just what is happening around you now, not on whatever's worrying you about your job, your bank account, the health of someone. You know, many things can get people worried and distracted all the time. So you just have to pick one. This is a progressive muscle relaxation where you sequentially go and tighten a muscle, like in your hand, but you go through your whole body. Okay, you pause and then you relax it, and then go through all of them. These are many different techniques. So when do you need to seek psychiatric help? So as I mentioned, the screenings are up, and maybe 3 to 4 times the incidence of baseline. There's a lot of people with anxiety and depression, and some people with PTSD, and some people with survivor guilt right now. But you really need to come in when symptoms are interfering with your functioning. You're functioning at work, you're functioning at school, your social functioning, you're functioning with your family. So for example, I'm worried about getting infected with COVID-19, infecting other people, potentially being responsible for my elderly parents dying, the economy, inflation. I'm taking all the precautions, and so on. Is that normal? So really the question is, these worries that this person's having, which sound like obsessive compulsive disorder a little bit, or a lot, how much time are they spending on this? Are you spending on this? How much worry-free time do you have? Is the worrying and the other precautions interfering with your functioning? So if you're just worrying about these things for like 10 minutes a day, or altogether, if you added up all your worrying for 20 seconds here, 20 seconds here, it's really like 10 minutes or less than an hour. It's really not interfering with your functioning. But if it's adding up to a couple of hours and you can't function, it's always in the back of your mind, well, then obviously if that's the time you need to seek psychiatric help, and psychiatric help is available. Psychiatric practice is a low-risk environment. What do I mean by a low-risk environment? High-risk environments are environments in which sick people are close to each other, like less than 6 feet from each other, and they're sharing air, like, so basically, if people are going to be close to each other within 6 feet, they definitely should be using masks if it's going to be for more than a couple of minutes where they're near each other, okay? So how do people do this in psychiatric practice? They screen the patients before they come in to see if they have symptoms of some sort of upper respiratory infection, or if they've had very recent contact with someone who has COVID-19. And if they do have that, they try to treat the patient with telepsychiatry, and they tell the patient to quarantine and contact their primary care doctor if they're struggling, and so on. And doctors get paid for this, doing treatment over telepsychiatry. All doctors do. Dermatologists, primary care doctor, everybody gets gets reimbursed for this. So it's not an issue, which was an issue in the past. The insurance pays for this. Medicare pays for this. And when you see the doctor will keep some distance from you, or they'll wear a mask. If they're spending a prolonged session, which every psychiatric session is a long session. I mean, generally a psychiatric appointment is at least, 20 to 30 minutes. An initial appointment's usually in an hour. Anyways, and patients should never delay being seen any severe symptoms. And any severe symptoms should ideally be assessed in person, because it's not ideal to just assess someone remotely. And if people are close, I'll go into TMS a little bit, but when people are doing transcranial magnetic stimulation, which is a treatment where people are right next to each other, then you use a mask. And if you're getting electroconvulsive therapy, which is shock therapy, then you use a special type of mask, which is called an N95 mask, which I know you've all heard about because there was a tremendous shortage of them. And these same instructions are the instructions that I gave in a presentation to psychiatrists, essentially exactly the same. Patients are screened, you clean the office and the hands more, and use telemedicine for follow-ups and reliable patients, but face-to-face initial appointments in the severely ill, you still do TMS and ketamine and long-acting injectables like some type of antipsychotics. You do hospitalizations and eating disorder and substance use treatments. All these things are still available. So this is just to explain a little bit about TMS. Transcranial magnetic stimulation is basically a way of treating the brain, non-invasively, meaning without going into the brain, using magnetic pulses. So you have here a coil. Coil is just essentially a wire. You have a wire through it. So if you have a wire with a current going through it, it has a magnetic field that corresponds to that. That's that purple line here. So it's capable of inducing a current in a conductor that's under it. So here's another wire under it. It'll induce a current in the conductor. So in this case, the conductor are the neurons in the brain. And what will happen to the neurons in the brain is it'll cause a depolarization of the neurons. So when you have a person has depression, or a person has OCD, or a person has other disorders, but right now it's FDA cleared for depression and OCD, what we want to do is we want to change the activity in the brain. And we do that by causing depolarization of the neurons. And that depolarization can be seen through movement, if we do it over the area of the brain that's responsible for movement, or you could look through with an EEG and see the activity, or PET scans and so on. And this is developed since 1985. The first device was approved by the FDA for treatment-resistant depression in 2008. And that was a figure 8 coil. And in 2013, BrainsWave received clearance for this coil here that you could see here that was invented in 2000 by Dr. Ruff and Dr. Zengin, which is an H coil, stands for the Chesed coil. And that was approved for depression. And in 2018, there was one that was approved for obsessive compulsive disorder, and different areas of the brain. And they treat a broader and deeper volumes, and they treat different areas. As you can see, this is one for depression, which is mainly focusing on lateral areas. And this is one for OCD, where the main field will be here, kind of medial. So I just wanted to show you this diagram here. So you see what happens during the treatments. Because the people are right next to each other, in these cases, both people will wear masks the entire time, and it's a daily treatment lasting between 20 and 30 minutes. So they'll wear masks the entire time. So the first pandemic that I remember learning about was a pandemic that occurred that affected the students of Rabbi Akiva. And you could see here in the Gemara in Yevamos, the Gemara says, Rabbi Akiva Omer, a person who learns Torah in his youth should learn Torah in his older days, and a person who has had Talmidim in his early days will have Talmidim in his older days. Anyways, it says he had 12,000 pairs of Talmidim from Gvat until Antiparas, and they all died in one period of time because they did not treat each other with respect. And the world was desolate until Rabbi Akiva, until he came to the south and he taught it to them. And who were those people? Rabbi Meir, Rabbi Yehuda, Rabbi Yosef, Rabbi Shimon, Rabbi Lazar, Ben Shemua. And they reestablished Torah at that time. And it says that those 12,000 pairs, those 24,000 students, they died in Mesumi Pesach Vadatzeres. Okay? And Amar Rabbi Chama bar Abba, V'itema Rabbi Chia bar Abin, Kula Mesumi Sarah, they all died a bad death. What is that bad death? Ma'hi Amar Rabbi Nachman Askara. Okay? So the death is that specific death is called Askara. Here. And in Bameh Medlikin, the Gemara says that there are four indicators. There are four indicators for different sins, and one of the indicators for sin, Askara. So Siman Lashon Hara Askara. So an indicator for people who are saying Lashon Hara is Askara. And Askara is, my dad told me, is diphtheria. Okay, so corynebacterium diphtheria is something that we don't really see nowadays. It's pretty rare that we see it, but basically it's an infection that's caused by a bacteria that causes kind of a pseudomembrane, there's a toxin that the bacteria causes, which causes like this person essentially to choke on their own throat. So in here, the Gemara goes ahead and says that Askara, why does Askara come to the world? And the Gemara goes through several explanations. One is Askara comes because of Lashon Hara. One says it comes because your people aren't giving Meiser. Another person says that the Askara comes because of Bittul Torah, etc. And they're talking about how horrible this death is, or how horrible this specific death is, which is obviously another mentioning of this terrible pandemic that went on the Talmidim of Rabbi Akiva. And it's kind of unusual. It's not kind of. It's a very unusual thing that the students of Rabbi Akiva. That happened with the students of Rabbi Akiva, because if you think about them, we don't really know much about the students. We know a lot about Rabbi Akiva, but we know a tremendous amount about Rabbi Akiva. We don't really know much about these specific students of Rabbi Akiva, these 24,000 students of Rabbi Akiva, but we actually mourn them like more than 2,000 years later, which is very unusual. We spend a tremendous amount of time mourning these people. We have, this is the Orach Chaim, the Shulchan Aruch saying, the Shulchan Aruch in Orach Chaim saying that there's customs of mourning that we continue years later, over 2,000 years later, that we do not get married, and we don't get haircuts and other things for a very long period of time, like for many, many weeks during the Sfira. And what's the reason we don't do this? That we don't do this for all these weeks because of the students of Rabbi Akiva. So because of this mourning, basically wedding halls and caterers and musicians are all like struggling in business. So obviously, I'm sure before the rabbis made this custom, they certainly took these considerations quite seriously. They didn't just decide to, to just affect the economy so significantly. So I think it's interesting I think it's interesting, and it's a question as to why, number one, why that was, and number two, what exactly happened? What was the reason? What was the reason that they died? And what was the reason, like, what does it have to do with, like, people not, what was the reason they got Askara? Did they get Askara because they didn't get Askara because they didn't give respect to each other? Did they get Askara because they said Lashon Hara? Did they get Askara because of Bittul Torah? It's very unclear. But we still are mourning these people, so they clearly were very, very respected. So it's a very unusual situation. So if you look in the Medrash Rabbah, and I was referred to this by Rabbi Shirley Bornstein, if you look in the Medrash Rabbah, the Medrash Rabbah says the same story a little bit differently. So Rabbi Akiva Omer, if you had students in your youth, you should make students in your older age, because you don't know which will survive, this one or that one. And V'imshneim ke'achad tovim. Shemaser talmidim hayu l'Rabbi Akiva me'aku v'ad antiparis. V'kulam beperek echad mesu. Lama. She'haisa eineim tzara elu be'elu. Because they were stingy with each other. And I mean, I don't assume that was financial, but maybe it seemed that they were not generous with each other. V'sof hamid shiva. Rabbi Meir, Rabbi Yudah, Rabbi Yossi, Rabbi Shimon, Rabbi Elazar ben Shammua, Rabbi Yochanan Sandler, Rabbi Elazar ben Yaakov. And some say Rabbi Yudah, some say some other people. Amar lehem banai. Rabbi Akiva said to them, Harishonim lo mesu ella shahaisa eineim tzara elu elu. My first 24,000 or 12,000 pairs didn't die only because they were not generous with each other. They weren't elevating each other. They weren't generous with each other. Pay attention. Pay attention that you don't repeat what they're doing. They went ahead. Amdu umilu kol Eretz Yisrael Torah. So they went ahead and they filled all of Israel with Torah. And actually, those specific Talmidim are all the Talmidim that you say, Stam Mishnah and Stam Brisa. And these are people that basically went ahead and they went ahead and they were responsible for disseminating Torah after, quote, the world was desolate. So I just shared with you in light of some recent events that have been going on. And maybe it's not just recent events, maybe it's events that have been going on for a long time, maybe for many years already now. Because it seems like there was a problem, and there is a problem whenever there is a problem, whenever there's a problem of whether it's a pandemic or some other, later on there were pogroms at that period of time. Whenever there's a problem where a large amount of people are getting hurt, there's two approaches. You can have an approach where you can kind of worry about yourself, or you can have an approach where you try to worry about everyone and elevate everyone. And I think we know we know already from previous crises that there are going to be excess deaths of despair due to increased unemployment, suicide, substance use. And we know from previous crises that the more a problem is shared, the lower the suicide rate. Like if I'm the only person that loses my job, if I'm the only person who loses my home, if I'm the only person, I'm much more likely to have self-destructive conduct around that. But if everybody is hurt, then people can deal with it a lot better. And lack of insurance, for example, is going to burden the entire system. This is another thing that people sometimes don't realize. They don't realize that that what's going to happen, a lack of insurance is going to burden hospitals, because the hospitals have to take care of the uninsured. They can't just ignore people. It's going to burden all the city. It's going to increase the homeless. It's going to increase all these things, burden the entire system. It doesn't just burden that individual. So we have to be better, and we have to elevate each other in a serious way. So there are many things we need to do on an individual basis. We have to somehow increase and train resiliency. We have to help people become self-efficacious and increase optimism, and we have to increase social resources and help with better coping skills and cognitive appraisal. And so, there are many ways to do things we can do on an individual basis, and we also have to try to keep our own perspectives, but also we have to remember to respect every fellow human being and elevate every person, irrespective of differences. So even if you disagree or think a person is very different from you, you still want to try to help them or listen to them or just treat them like a human being, even if you completely disagree with what you think about them from a political perspective or from a religious perspective or some other way. So, thank you for your attention. Are there any questions?
Thank you, Dr. Tendler, for that wonderful presentation. We're going to take questions now. If you have a question, you could present it in the chat box, and we will try to present your questions to Dr. Tendler. I'll start, Dr. Tendler, by asking you, how does religion, faith, prayer, and other traits of religiosity contribute to one's stability and mental health and calm during crises?
I think we know that it's helpful, and we know that it's helpful from individual people. It helps people with individual crises, and it helps people with global crises, and it helps doctors, and it helps people who are struggling with addiction, and it helps people who are struggling with medical illnesses. Yeah, so it's helpful.
Specifically, what is it that's helpful? Is it the faith? Is it the prayer? How would you explain how religion contributes, and what could people practice more of, whether at home or in the social setting, to find more serenity and peace?
Well, I think we can maybe at another time discuss the theories behind how religion helps, but in practice, religion helps is that it gives a structure for people, a structure to engage in helpful behaviors during times of distress. So there's a famous saying, I don't even know who said it, that religion is opium for the masses, and it's not meant to. It wasn't meant to be said as a compliment, but actually it is in reality. It is in reality, because what it does is it gives a structure. It gives people a way to learn how to cope with a lot of harsh things. So it's a painkiller. It helps. It gives tells you what do you do, like how do you deal with hard times. Tells you how do you pray. Yeah, that's what organized religion is. How do you deal with this? What are you supposed to do, and so on.
We have a question from someone asking, how do you explain Israel with a population of over 8 million people and under 300 fatalities from the coronavirus?
I mean, I'm not I have my theories on these things that and I don't think that that's the point of this presentation, but obviously the assumption is that what happened in Israel and what happened in many places that had a lower number of deaths and not a lower number of deaths, a lower number of cases, okay, that it's related to earlier isolation and widespread testing. That's the general theory. And when you have, I don't want to come across as saying that I believe that that's a relevant long-term solution, because that's a very good relevant solution for a short-term solution, just to be clear on that point. So that's a very good short-term solution. But that's essentially what happened, is that when you have an infection and you lock down and you limit exposure, that's very nice, but at some point in time, you're going to end the lockdown and you're going to end the testing, especially if the virus is endemic, right? All that does is it spreads it out unless you actually find a cure.
Are there any positive traits that emerge during times of crisis? Like you mentioned that stress is a positive motivator. So as long as it's not a distress, it's actually positive. So sometimes more stress could be more positive as long as it doesn't get to the point of distress. Are there any other positive characteristics that could be harnessed during a time of crisis that people could tap into more of some positive attributes that are triggered by events like this, more noble characteristics that we can maybe access during these times more readily?
I think the most important thing is a sense of community and a sense of the problem being so whenever you consider an infectious disease, an epidemic or a pandemic, you're thinking about a lot of people having a problem, and what you're doing is not just affecting you, it's affecting everybody. So I think the fact that we're now thinking about other people and not just thinking about ourselves and individually, I think that's good. We're thinking about the community that we're in and all the communities around us. And I think that's what redefining the way we look at the world is important. I think there are other habits that are helpful. It shows us that we can change. So for example, people in general most people think that, well, I don't know what you all think on this, but a lot of people think that people don't change. They pretty much stay how they are and so on. But here you see a lot of people made it through months of being at home, months of doing schooling for their kids, and completely changing from ordering food and going out to restaurants to suddenly cooking. Doing things in one way, but now suddenly change to doing things in a completely different way. It really teaches you that people can change, which is also a tremendously valuable lesson.
That's a very good point. You touched upon, it puts things in perspective. Does sometimes the global crisis make people realize that what they thought were problems in their life are actually not problems?
Very true. Very true.
Are you, on a practical level, are you seeing an uptick in patients coming into your offices during the past 3 months? Or more phone calls or more prescriptions being ordered?
I don't think I see a difference personally. I think that we see an uptick in so I'm just one individual doctor, and I'm generally pretty busy, so I don't think I can see personally a difference. But I think like I said, the medical profession has generally seen two things happen. They've generally seen the people avoiding coming in for things that they should be coming in for. And I think that's a problem that has far-reaching, like the amount of evidence that goes into getting something. I mean, we're talking about, there's something called the U.S. Preventative Task Force, meaning when people go ahead and they get a colon cancer screening, and they get a mammogram, and they go ahead and they get evaluations from their doctors for cholesterol and certain things like that. Those things are only done 20 years after they're like discovered to be helpful. Those are like way after the curve, and everybody's very, very certain that this is going to make a dramatic difference in people's longevity. And that's fallen off. People are like not coming in for the care that they need to come in for. I think that people mostly are focused now on this one disease, which may be relevant, which is certainly very relevant for older people and less relevant for younger people. And yeah, unfortunately, they're not taking care of things such as their high blood pressure and their cholesterol and their general mental health. And many people are drinking more, and many people are not exercising and doing certain things. So those are problems that we're seeing. As far as me personally, I haven't seen a difference in my personal schedule, but I only see patients like 30 hours a week. So I'm kind of not a good example.
Right. One last question from one of our participants, and they asked that now that we're already in phase 1 and parts of Florida have gone into phase 2, and we're told we can go out under certain guidelines, what's if I'm still finding myself fearful of going out, even though the guidelines are now saying I can participate in certain activities? Is that normal or abnormal?
So I want to say that I think it depends on your age and your comorbidities. And I'm only answering this on a, so I think if you're a person who is in, 60s, 70s, 80s, or you have comorbidities, I think that it is reasonable to be avoidant. Now, there's a difference between being avoidant and being fearful. So if the fear is taking up your mind all day, if you make a decision, I'm not going to go to restaurants, and I'm going to use, I'm going to be very cautious going to the supermarket, and I'm going to be cautious, that's fine. That's not a problem. But if you're fearful all day because of these things, then you have a problem, and then you need treatment. I hope that answered the question.
Yeah, that makes sense. Well, thank you very much, Dr. Tendler. We really appreciate your time and your insight into these circumstances that are so unusual and novel for all of us. And stay well, and thank you for being a beacon of light in our community. And we've all gained a great deal from your talk, and may we all be able to be blessed with good health, both physically, mentally, emotionally, and spiritually. Thank you, everyone, for participating, and have a wonderful evening. Thank you.